Welcome to Shrink Wrap Hawaii. My name is Stephen Philip Katz. I'm a marriage and family therapist here in Hawaii, and it is my pleasure to welcome once again my wonderful, brilliant guest, Dr. Shari, a clinical psychologist right here in Hawaii.
Thank you.
Welcome. Thanks for coming again, Shari.
Well, thanks for asking me.
So, addiction. We were going to talk about addiction today.
Right.
You were telling me, why don't you share with the folks around the planet some of your experiences in that field?
Well, let me start off by saying, Bessel van der Kolk, the international traumatic stress expert, says that alcoholism or abuse, trauma precipitates alcoholism, and toxic abuse and trauma precipitate substance abuse. So when we look at addiction, we're talking about a compulsive behavior that is a coping mechanism for overwhelming emotions.
So what's the difference? How do you differentiate between toxic and you separate it into, like, one is trauma and the other is toxic trauma?
That's a really good question. Something like emotional abuse, verbal abuse, some physical abuse might be considered abuse trauma.
Uh-huh.
When you get into sexual molestation, sex abuse, extreme physical abuse, you're talking about toxic trauma.
Is part of the difference the
severity?
The severity and the frequency?
Exactly.
Uh-huh.
So
something that happens for 10 years every day, that's for sure toxic.
Right.
Yeah.
Right.
And so when you're treating addiction, how does that knowledge help?
First, let me qualify, I am not an addiction specialist.
Okay.
But in treating addiction, one of the things is finding out what the traumas are in the background.
Uh-huh.
So when you talk about addiction, let's clarify that. There's alcohol addiction, there's substance abuse, there's pornography, there's sex addiction, gambling addiction, there's spending addiction. There are all kinds of addictions, right? Anything done to excess is an addiction.
Well, to excess, and I mean, one of the criteria for me is if you could still do the rest of your life pretty well, you're going to work, you're having relationships.
Right.
I'm addicted to my cup of coffee in the morning.
Right.
But I'm not going to go seek help for it.
Right.
Because it doesn't interfere with my life.
Until it does.
Right. Right. Well, but isn't that true for most people? They don't do anything until it interferes.
We qualify it as an addiction when it interferes with functionality.
Yeah.
Right? So, some of the high alcohol rates are in the fields of medicine and in the fields of law, high stress fields. But we don't qualify it as an addiction until it interferes with functioning.
Right. So then you were telling me about some of the places you worked at in the field?
Well, I started working in 1986, I worked in the men's prison, and I've worked in every prison on this island.
Wow.
So addiction is very common. At that point in time, I wasn't trained to, we were not resolving people's addictions in the prisons. Since then, my training has taught me that when you resolve the trauma, you automatically resolve the addiction. Let me give you an example. Rage can be an addiction also.
Sure.
So I had a young man come in and tell me, I just want to get rid of this hair trigger rages. It doesn't take much. I can fly into a rage. I don't know why. It's spontaneous. I am not in total control of it, and it just happens. So that's at a visceral level, right? So we're not going to talk our way through it in a cognitive behavioral session. We're not going to do talk therapy. I immediately went to EMDR. I think every therapist needs to have some type of trauma therapy intervention in their repertoire because trauma inevitably comes up.
Could you review again for people who didn't see the last show what EMDR is?
EMDR is eye movement desensitization and reprocessing. It was developed by Francine Shapiro, There are over 3,000 publications on EMDR, so it's considered evidence-based. It has been in the field since the 1980s.
What does it look like when you do it?
It looks like bilateral stimulation. It's either sound, feeling.
So somebody would wear headphones and listen to
You
beeps?
can wear headphones, and the beeps are bilateral every other ear, right? Every other time.
Right.
It's holding paddles that have a vibration. They are bilateral stimulation. It's looking at lights that intermittently go off and on. So, yeah.
And just the doing of that can reduce the effects of the trauma?
When you go through a trauma, your brain freezes the memory. That's why it comes up. That's why it can be accessed, because it's a frozen emotional state. And when you are triggered, what happens is that emotional state comes up full blast. You know, people are often triggered over very small incidents that don't seem to warrant the amount of rage forthcoming, right?
Right.
Okay,
Right.
well, that amount of rage is not associated with the incident that occurred in front of them in present time. That amount of rage is associated with an original trauma that's had a cumulative buildup over time. And every time that person is triggered, that cumulative incident adds on to the original trauma. So what you're getting is, say someone was assaulted. You're not getting, this person is arguing with me. What you're getting is, I was assaulted in the past. You know, you're getting that person's former original assault and all the fear and all the anger. You're getting fight or flight in full-blown phase.
It's like they're instantly transported back to the moment of trauma.
Exactly.
Right, it's funny because like when you went like that, I thought some people could get triggered by that.
Exactly.
Right. Like,
Exactly.
you know, if you had a parent that was, whenever before you got hit, they went like that.
Yeah. So flashbacks, right?
Yeah.
People have flashbacks, they have nightmares, they have intrusive thoughts. They don't want to think about those things, so they stop thinking about those things. It's your PTSD symptoms, right?
Right.
Okay, well, it doesn't just happen to our veterans coming home. It happens to children in families with domestic violence. It happens to children when they witness spouse abuse, when they experience child abuse. You know, they may experience elder abuse. It happens in many, many seemingly normal walks of life.
I met a young man, 17 years old, who had this hair trigger rage.
Right.
And I need to get you training in the EMDR because you're right. The talk therapy, I mean, he told me about what happened to him as a child, how he was assaulted by his parent every other day for many years. Now he's bigger than his dad, and he's not fighting with his dad anymore, but
the rage is still there.
Anything happens. You know, somebody looks at his girlfriend the wrong way. He's like up in the guy's face.
Right.
And I think he wants to change it, but I don't think that just talking about it is going to help.
Yeah. Prolonged exposure is talking about it and 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 feeling the feelings, and that can take a while.
Right.
You could be in prolonged exposure for 6 months. And I'm not putting down prolonged exposure.
Sometimes it works.
It does work.
Yeah.
If you complete it.
Right.
However, if you get tired, if you're so upset by re-experiencing this trauma so frequently, you might not be inclined to complete it. In fact, half the research participants dropped out of the research project with prolonged exposure.
I mean, I can imagine, you know, if I know when I go to your office I'm going to go back into that traumatized state, it's like, really? I'd rather stay home and pair my socks.
Yeah, why would I want to feel helpless, powerless, dominated, overwhelmed, which is what you need to feel, right, to go through prolonged exposure. So when the brain is in a frozen state, it means it hasn't entirely processed the trauma. When we put your brain into a bilateral synchronization, both hemispheres synchronize, the brain resynchronizes while you're holding the memory, and what typically happens is the emotion that's associated with the memory dissipates.
So before you do the bilateral stimulation, you ask the patient to just think about that moment?
I ask the patient to focus on the worst part of the moment. What was the most difficult part for you? What is it that upsets you the most about the memory?
So like in a car crash, maybe the second before impact.
Or it might be the smell. When I was assaulted, there was this smell. I remember the smell. Or it might be I hear her voice screaming at me this one thing over and over and over. Or, you know, I don't even feel being hit because all I can hear are the sounds of his voice.
Wow.
Yeah. So I also had a young man who came in very traumatized, wanted to get rid of his hair-triggered temper. And he said, I think it's there because, he said, one thing I'm not comfortable with is I can't stand to have people behind me. When there's someone behind me, the back of my neck starts to prickle, and I immediately want to lash out. So we went back in his history, and he said, I know when it happened, I was in a men's restroom and I was jumped. I was assaulted from behind.
Wow.
So we processed that. And he came back and he said, well, you know, I don't have any emotional charge associated with that memory, but I am still uncomfortable with anybody walking behind me. I still want to lash out. So we processed another memory when he was in Mexico. He was running away. Someone was coming after him, clobbered him over the back of the head, trying to get his money. We processed that, and he said, I don't have any emotional charge associated with that memory, but I still can't stand anybody behind me. Now, this is a gentleman who thought he knew where his hair-trigger temper came from. I took a history on him and found out that he had polio as a child. And from age 5, he was hospitalized for 4 years, intermittently hospitalized, had bone marrow transplants, had spinal taps, just a lot of hospitalization. And I suggested to him that maybe his trauma started there. And he said, yeah, but the doctors and the nurses, they were all so nice. They were all so nice to me. We started processing his hospitalization. So what came up was, the doctors and nurses were so nice to me. They were always smiling, and then they hurt me so badly. And when they did the spinal tap, he was in a fetal position, and it was excruciatingly painful. And when they had to do other procedures, they held him down physically. So we processed that, and he came back and said, you know, I don't have a hair-trigger temper anymore. I get angry like everybody else, but I don't go into rages anymore.
Wow.
It's gone.
Wow.
But he couldn't find the original memory. It took some exploration between us.
Sometimes you really have to.
It took collaboration to figure out, you know, where is this coming from? He thought he knew where it was coming from. And I thought, that sounds reasonable, let's try that.
Yeah, it's funny how sometimes we have these memories that we don't know we have.
You know, that brings me to the overarching, EMDR is an overarching modality like CBT. So if someone saw a CBT therapist,
Cognitive behavioral therapy.
Cognitive behavioral therapist, if someone went to a CBT therapist for talk therapy and said, you know, that was great, but it didn't quite resolve my issues, they could go to another CBT therapist and talk about their issues. Because even though everyone is trained in standard fashion in talk therapy in the universities, everybody does it a little differently.
It's all different.
Everybody approaches it a little differently.
Right.
One approach that works with one person may not work with another.
And a lot, I think, you know, it's all about the connection.
Exactly.
Right, creating trust.
Exactly. So EMDR is the same way. I've heard people say, oh, he's already had EMDR therapy. It didn't work on him, so there's no point in him pursuing EMDR therapy. That's like saying, well, he's already seen a therapist. It didn't work, so there's no point in him ever seeing another therapist.
Right.
That's just not true.
Right.
EMDR therapists are as diverse as your CBT therapists.
Right.
The way they search for an issue is different.
It's like somebody saying, I already went on a date with one woman. It doesn't work. I'm not doing that anymore.
Essentially, yes.
Yeah.
So I want to clarify that. It's an overarching modality. If it doesn't work with one individual, try another.
This is a point we need to take a break. Who knows what's going to happen between now and when we come back. Stay tuned. We'll be right back.
Hi, I'm Chris Leatham here with Think Tech Hawaii, and I invite you to watch my show, The Economy and You, each Wednesday at 3 o'clock here in Hawaii on OC 16. We look forward to seeing you. Aloha.
Hi, I'm Donna Blanchard. My show on Think Tech is Center Stage. I interview artists of all different ilk on the show, and we talk about what they do and how they do it. Those are both really fascinating. What I find most fascinating about all of my interviews is talking to people about why they do what they do, what the process does for us, what the actual artistic process is. I hear all the time from people that they watch the show and they feel inspired. My guests tell me a lot that they feel inspired to go home and create something new and exercise, flex that artistic muscle. And I hope you will too. I hope you'll join us on Wednesdays at 2 o'clock on the Think Tech Hawaii digital series.
Addiction with EMDR.
So here we are. Thanks for sticking with us. Part 2 with Shari Ao, clinical psychologist here in Hawaii. We were talking about EMDR, and we were just about to relate it to addiction.
Right. So how does it work? When your brain is in a relaxed state, your brain works
I
in
talked
synchrony.
about memories we don't know we have.
Right. When your brain is in a relaxed state, your brain works in synchrony. It's like an orchestra. Right, with the frontal lobes conducting the orchestra. When your brain freezes, whether in high anxiety, in fear, in grief, that is no longer a synchronized state. And that is why that memory is locked in a frozen state, compacted with all the emotional charge that originally occurred with it. So,
I like that visual picture of the memory being stuck, and the idea is to get things flowing again so you can release it. Yeah.
Exactly. So when we put your brain into this bilateral synchronized pattern, we are actually bringing the synchrony back into the brain. While you hold the memory, while you hold this frozen memory. So your brain can only sustain one state at a time. And as we bring your brain back into synchrony, all the emotional charge typically drops off of the memory. People will say, well, gee, you know, I remember it, but I don't have that feeling in my throat anymore. Or I don't know, it just doesn't have any emotional charge. I'm not sure what happened, but I just remember it, but I'm not reacting to it anymore. When we started, my first reaction was, yuck. I don't want to think about that. But now I can think about it and it has no effect.
So then, connecting that to the addiction piece, if somebody is using drugs or alcohol or whatever it is to calm themselves, to medicate themselves because of this trauma, if you remove the trauma, no more need for the drug or whatever it is you're using to forget about the anguish of the trauma.
In a clean theoretical model, that's exactly correct.
But
not everyone has a clean theoretical model in their lives. You know, you have kids with sex abuse who run away from home, and then they're living on the streets in prostitution, and then, you know, other things happen, and you have trauma on top of trauma on top of trauma on top of trauma, and then they end up in a rehab. And I've asked a young woman, what happened? You know, you were in the military, you had a great career. How is it that you're on the street? And how is it that you have a, you know, somebody selling you on the street? I don't understand how you could go from here to there.
Right.
And she didn't explain a lot, but I'm gonna guess, you know, she had a lot of trauma in her childhood. She went into the military to start a new life, but it doesn't resolve all the past traumas. So it didn't take much. She said a man happened.
Isn't that often the case?
That was the trigger.
Right.
And her entire life spiraled out of control. So She was in rehab, she was detoxing. This is substance abuse, this is alcohol use, and I don't know what happened to her thereafter, because most rehabs don't do trauma therapy. I was telling you, I think any therapist needs at least one trauma therapy in their toolkit.
Right.
There are half a dozen trauma therapies that are rapid, that are effective. Now, different things are effective for different people.
Right.
I did a one-year postdoc in EEG neurofeedback. I was impressed because by training the brain, you can literally train the brain out of a PTSD reaction. Did you know that?
No.
Yeah.
You mean through watching the EEG?
They attach electrodes to your brain which pick up brain activity.
Right.
And by your watching or guiding a spaceship on a video, they can activate different parts of your brain.
Okay.
Training your brain to activate different parts of your brain. And the more you train your brain to activate different parts of your brain, the less likely you are to be depressed, the less likely you are to feel compulsions, the less likely you are to have insomnia, the less likely you are, a lot of fairly miraculous changes.
A lot of the alternative therapies these days seem to be very focused on taking control of your brain.
Now, that's the other thing.
I'll do like mindfulness meditation,
Right.
which I love and try to practice as often as I can.
And Bessel van der Kolk supports that. He supports yoga. He's done research on yoga, the mindfulness.
But just being aware that I don't know, like when you're watching your brain, who is watching your brain? It gets very almost spiritual, right? Because if we're not our brain, who are we? I don't mean to get, real woo-woo about this, but who's doing the watching?
So let me get back to We have EEG neurofeedback. There's EMDR. EMDR, I told you, is evidence-based. Thought field therapy. Roger Callahan introduced thought field therapy at least.
TFT, the tapping thing. Yeah,
Tapping.
I use that with patients.
Following the acupuncture
simple.
meridians. Very simple, very effective.
Yeah, it's amazing. I don't understand why it works, but it works. I used it to cure my fear of getting shots with needles.
Excellent. So I used it in the court system in Guam when I had a young man come in who was so angry. I was supposed to do a psychological evaluation on this young man. He was so angry. I mentioned, you look angry. Are you angry? And he said, I want to smash something. So I thought, let's try. Would you like to take the edge off of that? And you don't have to do anything. I'll just tap different points on my body. You tap them on your face and body. That's all we'll do. At the end of the tapping sequence, he started volunteering information. He was no longer angry. I got a full psychological eval on this young man. I saw him a second time. He came in and I asked him, where's your anger? This is a young man who had been assaultive throughout school. He was a bully. He was very assaultive. He was in the juvenile correction system because of his assaults. And he said, my anger is at, a 2 or 3. I thought, that's pretty impressive.
On a 0 to 5?
On a 0 to 10.
0 to 10.
Right. I thought that's pretty impressive considering he came in at a 11. So we did more tapping, and he sat there in the office. This is only the second session I've seen him. And he said, in my entire life, my anger has been raging. This is a young man whose father was in prison, who he and his mother were living with his brother, his invalid brother, with his uncle. And there was quite a bit of domestic violence, verbally and just physically, and door slamming and things being thrown and threats to property damage and threats to being beaten up. But he said, for the first time in my life, my anger is at a -3.
-3.
I thought, is that possible? It's just, my anger is at a -3. And then the social worker, I didn't see him again. The social worker told me, oh, I like this new this turnover he's made, he's completely different. I mean, he used to be so aggressive, and he's so sweet.
So, I don't understand how this works, do you?
The acupuncture meridians, if you remember, we put needles into the blocks where the highways are blocked to allow the energy to flow. Right. When you tap, it's called sham acupuncture because you have a better chance of hitting the correct spot by tapping because it creates a vibration like throwing a pebble into a lake. It creates that reverberation. Then you do with a needle. With a needle, you have to be extremely accurate.
Right.
And
you
the
hit the wrong spot, you missed it. Yeah.
And people are different.
Besides, I don't like needles.
Me neither. People are different. So by tapping on the point, you have a much higher likelihood of hitting the
Oh, right, because you're not actually hitting the same spot every time.
But you're getting the same effect.
You're right in the neighborhood there.
They have measured the effect, and it's the same as putting the needle in.
Wow. So she just asked me in my ear, my producer over there, is it dangerous that man who went from a 2 or 3 to a -3, or I should say an 11 to a -3, is there any danger in somebody like changing so quickly?
Actually, it's a gift that he can change that quickly. Think about it. He could be in therapy in prison for years.
Right.
Instead, we took that anger, we resolved it with the tapping. He no longer felt that anger. That's not to say, in the home situation that he was in, that he wasn't going to get angry again, because I heard through the social worker, he went home, he said he was cutting vegetables, and his brother had the radio up really loud, and his uncle threatened to break the radio if his brother didn't turn it down, and his brother threatened to fight his uncle if he broke his radio, and his mother got so upset, instead of eating her lunch, she ran into the bedroom and slammed the door, and the uncle, knowing she's diabetic, went after her, pounding on the door, screaming that she had to take her medication and she had to come out and eat. And this young man continued to chop vegetables, right? He was chopping vegetables. I think this is the worst time to have family arguments when somebody has a knife in their hands.
Right.
But he reported to his social worker, it upset him, but he just continued to chop vegetables.
Wow.
I think that's pretty remarkable from a boy who had formerly been, high risk.
Yeah. I mean, I know that more than talk therapy is needed, because...
So here's the thing. I think every therapist needs in their toolkit at least one trauma therapy. We talked about EEG neurofeedback, we talked about EMDR, we talked about thought field therapy. There are other therapies on the horizon with very good reports.
I know a therapist who's actually been on the show who reports on herself fantastic results from massage therapy.
Right.
That while she's getting a massage, the
releases.
It just contacts the trauma, and like all of a sudden she's crying.
Yeah, there is the theory that Bessel writes about the body tells the story.
Right. The body keeps the score.
Trauma is locked in your cells.
Yeah.
It's not just in your brain.
Yeah.
It's cellular. So through the massage, theoretically, you can release those knots, and you're releasing that cellular memory. I've never had this experience, so I'm talking to you about information I have.
Right,
But there is also brain spotting.
What's that?
Brain spotting is...
So like train spotting?
No, you find a specific point, and the person stares at one point, and you hold that and allow their brain to process through that point. So one therapist reports after he found the point, and you'll find that the eyes will lock on that point, the client went through a series of life traumas, just one after another, after another, after another, after another, after another. And by the time she was finished, she had been having trouble ice skating with a coach. She executed her triple axel. Wow. No problem.
Wow.
So brain spotting is on the horizon. because it doesn't have this cumulative convergent research, we can't call it evidence-based.
Right.
It needs time to accumulate that research that proves that it works, and it works consistently, and it does exactly what it's purported to do. There is lens neurofeedback, and lens neurofeedback is coming out of Canada, and they are reporting remarkable success.
Hold that thought. We'll come back to lens neurofeedback.
Right.
All right. After our break, don't go away. This is Shrink Wrap Hawaii. Don't.
Hello, my name is Crystal Kwok, and I'm a newbie here in Hawaii from Hong Kong, and I really want you to get to know me. And if you're interested in some sensitive topics about women, things that provoke you to say, hey, I want to say something about that. The conversation about private parts, geez, I have so many things I want to share with you. I want things to put on the table that will incite you to think about what it is to be a woman and just be there and tune in to who you are. So please join me. My show is on Tuesday mornings at 10 o'clock. Sometimes it's going to be sexual, sometimes it's going to be dirty fun, sometimes there are going to be some hardcore social issues that involve us. So I really, really think it's an important time nowadays to bring everything like that together. And I hope you come in and join me and to embrace this deep but fun and entertaining discussions about women.
Either way.
Yeah.
So, getting right back here, we were talking about various alternatives to talk therapy that therapists should have in their toolkit, and I was sharing with Shari about a client who came in with an addiction that is totally, I think I don't know if it's a hidden epidemic, but it's definitely an epidemic. I'm seeing a lot of it in my own practice of mostly men coming in addicted to watching pornography online to the point that it's interfering with their work life, with their home life, with their sex drive, with their partner. It's something that is really getting in the way. And so the talk therapy, I don't know, for some reason I tried TFT, thought field therapy. And my attitude is always sharing my own personal story about how I don't know why this works, if this works. It sounds a little far out to me, but I had this fear of needles and I had to get a TB test. And I tried it and I said, well, when are you gonna do it already? And she said, I already did it. And ever since then I do the tapping thing and I'm fine. And so I said, I don't know if this is going to work on you. I try to be honest about it because it's not going to work with everybody. And I think it also takes off some of the pressure, of thinking, it takes away the client fighting the therapy because I'm not offering any resistance. I'm saying, I don't know, maybe it'll work, maybe it won't. Give it a try, it won't hurt, right? And so I tried it with this guy. He came in for his first session. I gave him the algorithm that where to tap. You hum a little tune, you count to 5, you look here, you roll your eyes, you do that. It sounds so silly, right? He came back the next session and he said, I don't need to watch the porn anymore. And I was more surprised than he was, I think. I said, really? No kidding. That's amazing, And then, he saw no need for further treatment. So either he didn't feel the need to stop watching porn anymore. There was no more problem, or he really didn't need to watch porn anymore. He was being honest with me.
I think he was being honest with you.
Yeah. And I still don't really understand. Like, you can explain to me about the points, the chakras, and the what do you call them? The points where you put the needles. What do you call those?
The acupressure points.
Acupressure points, right? But I mean, regular Western medicine doesn't even acknowledge that those points exist, right?
It's a different medical system.
And that's why I think sometimes, with all of these alternative therapies, we're always waiting for peer-reviewed, evidence-based proof, but sometimes it's very difficult to come by when it's a whole different system of medicine, unless you do, long-term longitudinal studies and follow up, which is very expensive. And it's always been one of my complaints with the treatment centers, the drug and alcohol abuse centers. there isn't a lot of long-term follow-up. So, at the very most, they'll do 5 years, but usually it's more like a year.
Very often the clinicians, frontline clinicians, are the ones that first introduce anecdotal evidence that this works and this has been working.
Right.
And that can inspire the research to be done, but it has to be done in a controlled circumstance.
Which is hard to create.
So we can't just attribute our successes to the environment or what they ate or
to the therapist-client
exactly.
relationship.
Yeah, it has to be done in a controlled circumstance, and
But
that
we
doesn't
don't
mean
live in a box.
it doesn't mean it doesn't work, because
Right.
in the 1980s when EMDR was first introduced, it didn't mean it didn't work. It just didn't have sufficient evidence base.
Right.
Now it has sufficient evidence base. It doesn't prove it works any more than it did when it was first introduced,
That's an interesting concept.
because it always worked.
Right.
But now we have, 3,000 articles, published articles that have controlled situations where it did work. So now
Right.
we can say, okay, now we have evidence that this works.
Yeah. Right. Yeah.
Irrefutable evidence.
But there's nothing stronger than saying to somebody, well, it worked for me. I don't know if it's going to work for you,
Right,
but it won't hurt.
right.
That's what I
And
like a lot about these things
EEG
versus taking drugs.
Yeah, EEG neurofeedback works for a lot of people. It doesn't work for everybody. EMDR works for a lot of people. I don't know that it works for everybody, TFT works for a lot of people.
Right.
And lens neurofeedback is making a difference with people with dual and multiple diagnoses.
Oh, you were about to talk about that. Tell me what that is.
People with dual and multiple diagnoses say, you have a personality disorder, there's perhaps borderline intellectual functioning, there may be depression, triple diagnoses, major depression. So these are very difficult individuals to work with. One personality disorders are very challenging to work with and quite resilient. So lens neurofeedback, the way it has been introduced is that it establishes a new brainwave pattern. And it allows the old brainwave pattern to remain, but when you have a new brainwave pattern, it neutralizes the old pattern.
So when you say lens, you mean the lens in the eye?
Lens
No.
neurofeedback is just the name of the EEG, a type of neurofeedback.
Oh,
They're
named after
different-
some guy named Len, or is it lens? The kind of lens?
LENs. I honestly don't know why they named it lens
I'm just curious,
neurofeedback.
I'm sorry.
It's a good question, but I don't know the answer to that. And because they're having such remarkable diagnoses of taking people who have been homeless for years with, say, schizophrenia and depression, and doing this and actually getting them employed. This is
That's
pretty
amazing.
remarkable.
That's
Or
amazing.
people who have been unemployed for 16 years
Right.
due to their mental health, and these individuals returning to employment,
If
being
you can do that in
employable.
a significant way, you would empty out many of the mental institutions here.
So that's
and
what
the prisons.
that is what they're reporting. In fact, it was reported at the last EMDR conference. It was pretty impressive, very impressive.
So you brought up schizophrenia, which is
Now, the latest research on schizophrenia is that it may start in the gut.
really by the bacteria in your gut.
Right.
That's
Isn't that amazing?
fascinating.
Very fascinating. But they're finding that depression has, is reflected in the gut.
Uh-huh.
They believe it starts in the gut. Depression, anxiety.
So are the people doing like cleanses and stuff like that? What are they doing about that?
The last schizophrenic client that I worked with, I discovered that he had been going through micronutrient depletion ever since elementary school. He was such an extraordinarily high achiever, always at the top of his class, at the top of the school.
Which is very common that I found among schizophrenics, because I work with NAMI, the National Alliance on Mental Illness. I run a support group here, which is happening tonight at Castle Hospital. A little plug for that group. You can just come on by, 5:30 this evening. And at least half of the parents and relatives of loved ones who were there have loved ones who have schizophrenia, and it's devastating.
So these high achievers,
Oh yeah, and that's why I said that, because most of them are high achievers.
type A personality that drive to be the best, to accomplish more, to continue accomplishing. I discovered this young man had micronutrient depletion pretty much all of his life. He was constantly running himself into burnout ever since elementary school, intermediate school, high school,
How did you figure that out?
Harvard. Because he told me, well, I've always had a susceptibility to this.
Uh-huh.
I said, how do you know? He said, well, because it would happen, after the exams, I would go through this depression and I would have anxiety attacks about the results. And, this is cyclical in his life.
Mm-hmm.
And he was,
Was it related to what he was eating?
well, now you're getting into a whole different ball game because, McBride has a book out called The Gap Diet, and she talks about curing. She started a clinic in Boston. She talks about curing all types of disorders, including autism, including ADHD, including bipolar, including psychosis, with diet.
Wow. That would be pretty cool.
Yeah, and she started that, like you, with her own daughter. She's a medical doctor, she's a licensed physician. She went through the gamut of interventions, could find nothing to cure her own daughter, who was severely disabled. And she went into clinical nutrition, and today she has a clinic on nutrition, a nutrition clinic.
It's called the GAP diet?
GAP Diet.
Well, I'll have to
The
check that
gut
out.
and psychology syndrome.
That's what it stands for?
Yeah.
Wow.
Yeah, gut and psychology syndrome. So she had already published her findings regarding, it starts in the gut.
Mm-hmm.
Now, I think it was Time magazine published findings that it starts in the gut. And this is pretty remarkable when we talk about why does this individual have a psychotic break and not this individual? Is it simply a genetic predisposition?
Mm-hmm.
Is it environmentally triggered?
Mm-hmm.
Because they say you can have all kinds of genetic predispositions. If it's not environmentally triggered, you will never show the symptom, right?
Right.
So you need quite a few things. You need the genetic predisposition, you need the environmental trigger, and then you need something to sustain it. And apparently this young man had it because before finishing his PhD at Harvard, he dropped out because he had a psychotic break.
Which was the exact story with, what's his name? This famous writer, son, who was schizophrenic, who was also a Harvard-trained pediatrician, who had a schizophrenic break before he went to medical school. And then he went to medical school after getting cured, fixed, whatever. Then he had another break, like 14 years into a very successful pediatric practice. And after the break was okay again and is still practicing. It's, what's his name? Why can't I remember?
It makes you wonder what interventions did he use to get himself back on track?
Yeah, that's what really wasn't clear. I mean, he had all kinds of treatment, including shock therapy. And he said the impression he left was that he was never doing medication, which is pretty amazing, how he avoided that.
Yeah, there's research out that medication tends to harden the psychotic episodes into more long-term psychosis. So in
Well,
third
and even
world,
when you're not in psychosis, the medication can make you very dopey. Fuzzy thinking.
do you know what the medications are?
Well, I know some of them, yeah.
Antipsychotics, neuroleptics are
Right.
essentially major tranquilizers. So it tranquilizes all your sensory system down in order to tranquilize delusions, in order to tranquilize
We're
hallucinations.
closing down. I don't mean to cut you off, but she's
Okay.
cutting me off. Come back next time for another edition of Shrink Wrap Hawaii. Thank you for listening.